И начнем мы наши доклады с доктора Марцина Амброзиака, который приехал к нам из Польши, из Варшавы. И он поделится своим большим клиническим опытом, расскажет нам об инновационной системе XLV, о самом современном лазере для удаления сосудистых мальформаций. Поэтому вам слово.
Спасибо большое за приглашение. Но извините меня, я очень плохо говорю по-русски, так позвольте я буду говорю по-английски. Thank you for the invitation. I'm not working for CUTERA. I'm a dermatologist working in Warsaw. We have quite a big clinic in the city center, employing about 40 employees. In the field of the aesthetic medicine, we have dermatologists, we have cosmetologists, vein surgeons, so we have just a nice conversation with the vein surgeon. And 4 years ago, I was looking for a system which could meet our expectations, because we wanted something to work not only for the leg veins, but also for the telangiectasia, for the flushing, for everything connected with the vascular problems. So the reasons, normally we check all the devices that we want to buy. We're not buying only from CUTERA. We're trying to pick up the best systems from every company in the world. So you got to have something which is efficient. That's the most important, because you have to have a tool that is effective on what you want to do. Then it has to be safe. It would be nice if it was versatile, and it's very important for all of us as users. It has to be easy to use, because we were trying to work with other companies, very good systems, very efficient, but for example, if I wanted to change the fluence, because I couldn't see any difference in efficacy, the machine calibrated every time 20 seconds, so it was very, very annoying. So you can ask me, is it something new, the KTP? Because the CUTERA XLV is nothing but the KTP 532 nanometers and 1064 Nd:YAG. Nothing new. It was 20 years ago. We were using those KTPs with a spot size of 1 millimeter. And it was quite effective and very difficult to use, because it was time-consuming, and patients had a lot of cross, and so on and so on. So I've chosen to show you some pictures on port wine stains, which I find very difficult to treat. Excuse me, can I have a silence, please? Thank you. Thank you. So you can see a girl from the
Да, мы сделаем последовательный перевод. То есть будете вы говорить, будет говорить переводчик. Параллельно с вами последовательно.
Ладно.
Хорошо? Все, прошу прощения.
Am I talking too fast?
You're okay. You're all right.
Sorry for this. So,
Итак.
Yes. Let's do. So we've chosen some pictures with port wine stains, which I find to be very difficult.
Ну, мы нашли вот такие фотографии. Вот видите, здесь такой дефект, это винные пятна. С ними очень трудно бороться, такое мое мнение.
To prove that the system is really effective.
И я взял именно вот этот случай, чтобы доказать вот эти винные пятна, чтобы доказать, что система действительно эффективна и она дает хороший результат.
Of course, it is not one session. To get such a result, you need to have a patient in your clinic for at least a year.
Но вы знаете, конечно, это не одна процедура. Чтобы получить вот такой результат, как у этой девочки, надо, чтобы она ходила по меньшей мере год в вашу клинику.
Which is anyway half of the treatment needed comparing to other systems from competitors.
Но вы знаете, но тем не менее, это по времени практически половина того времени, которое нам бы понадобилось, если бы мы лечили девочку системами конкурентов CUTERA.
Okay, that's another difficult patient with
Вот
after-burning red-brown dyschromia.
Вот видите, еще один сложный случай. Это наша пациентка. У нее был ожог, и у нее красно-коричневая дисхромия.
It shows the versatility of the system because it is effective not only in vascular lesions but also in pigmentation problems.
Как мы видим, здесь показывает универсальность нашей системы, потому что система помогает лечить не только сосудистые нарушения, сосудистые мальформации, но и избавляться от пигментных пятен.
And one of the major advantage of the system
И
is
одна
the
из самых
software.
больших преимуществ этой системы
Is the software.
– это программа.
Прошу прощения, мы наладили оборудование для синхронного перевода. Да, просим прощения за неудобство. Да, значит, снова все одеваем наушники и слушаем. Спасибо.
Okay, thank you. Yeah, carry on. All right. So, if you have a patient like 10 times a day with the vascular problems and you are expert in the field, you may forget what settings to use when you have a patient which is quite rare indication like this one. So the system shows you what settings should be applied. And it's so easy. I will show you the face, the screen of the system. You have different things here. That's the wavelength 532, and you choose the Fitzpatrick phototype, which is, for example, in Russia, I think it's 80 to 90% of people is 1 to 2 phototypes. So we pick one. We pick photorejuvenation, red-brown dyschromia, and that's it. You have all settings done. You have fluence by 6 joules per square centimeter. You have pulse duration, 11 milliseconds, and you have 12 millimeter spot size. And on contrary to, because we got used to the settings from the manufacturer that are useless, because you're getting the settings that are very safe, but they are not effective. I would, if I were you, for the beginning, I would keep on doing what the system says, because it's just enough. So you, at the end point, you may be not an experienced doctor, and you may treat a very difficult indication like port wine stains, red-brown dyschromia, leg veins. You don't have to be master of universe to start with your patients. And you don't have to forget it. You don't have to remember that, so it's also nice. The indications are, first of all, telangiectasia and veins of any kind. So you can treat with one system everything which is vascular. Telangiectasia, veins on the legs, a little veins on the nose, port wine stains. Theoretically, we treating port wine stains when they are red or pink with 532 nanometers, and when it is purple, then we choose 1064, which penetrates more deeply. You can treat rosacea, flushing and redness, angiomas, which is mostly one session to get rid of angiomas. Lentigo on the dorsum of the hands, of the face, it's also usually one session. And even plain and normal warts. Plain on the face, warts on feet. It's quite difficult, the warts, because the healing time is like 2 to 4 weeks, but nevertheless, in some resistant cases, you may use after you do the curettage, after you do the cryotherapy, and it's non-effectiveness, then you may use 1064 XLV. Angiomas, venous lakes, port wine stains, any kind of vascular and pigmented lesions. That's another advantage. And I must tell you that I bought the system when I saw this slide only. So I even haven't touched the system, and the representative of CUTERA told me, are you experienced with the lasers? I said, yes, I am. So you have a system which has fluence from 1.5 to 42. 42 joules is a hole in the skin, so we're not using this. But the range, it means that it's so powerful. or for 1064 from 4 to 300 joules. Pulse duration, this is very important variable, from 2 to 40 milliseconds. You can burn or cook the vessel, or you can damage it like a bomb, if it is a very small time or if it is 40 milliseconds. So I can show you the difference. How many of you are experienced with lasers? Raise your hands. One. Okay. Two, three. Okay. So this is a very good tool for you, and you already know everything, and you will know how good it is by the slide only, the ranges. Yes, the possibilities that the machine gives you. The rest will just have to follow the guidelines. And you may be, sorry to tell you that, nearly as expertise as those three. The difference between 2 milliseconds and 40 milliseconds. This is 40 milliseconds. This is laser, this is blood vessel, and the water is energy. So this is 40 milliseconds. The same quantity of energy is leaving the laser and getting into the vessel. That's 2 milliseconds. So if you have a small vessel, sorry for this. That's okay. So if you have a small vessel and you want to just blow it up, then you set 2 milliseconds or small time pulse duration. If you want to cook a big vessel on the legs, you have to go like 40 milliseconds. Then you see that it disappears. So the range is very important. And spot size, 2 to 12 millimeters. It means that almost even square centimeter is treated by one shot. So you are able to treat the whole face full of capillaries within 10 minutes. Of course, you will have some swelling and so on, but you are able to do the treatment within 10 minutes. A repetition rate is up to 2 Hertz. If you have a spot size by 12 millimeters, it's very fast. 2 Hertz is 2 shots per second. If it is 12, you have barely time to move the handpiece. Real-time calibration, this is what I was speaking about a minute ago. You don't need to wait until you change between the settings. You may change from 532 to 1064 within 2 seconds. So if you see that it is not working and you want to go deeper, then you just change to 1064 and you continue treating. So this is in comparison to other systems in the market, this is amazing. 2 wavelengths, full range of indications. Cooling handpiece is very essential because you cannot anesthetize the patient before the treatment on the face because you will contract the blood vessels. So the cooling handpiece is killing the pain and is lowering the after-treatment edema. No consumables. I'm quite surprised that we have an American company that is not taxing us again. It's so annoying that we have to pay for the system and then for the consumables. So you don't have any consumables here. And the sapphire tip, which not only cools the skin before the shot, but you can see through the sapphire glass how it disappears. So it's very, very useful. Okay, just one minute for the basic physics. You can see the absorption of the hemoglobin in wavelength. So the 32 is first peak of the absorption in hemoglobin and melanin as well. That's why with 532 you can treat most of the vascular lesions and pigmented lesions. The second peak is for 1064. And the difference between those two is that 1064 goes much deeper into the skin, so it may reach the deep vessels. So if you have something which is blue, something which is deeper, then you use 1064. That's a general rule that superficial vascular lesions you treat with 532, and something which is deeper, which is more purple, then we choose 1064 nanometers. And one thing for the spot size, which is quite important, and we very often forget about this, that if you increase the spot size, then you increase the depth of the penetration. So if you want to go deeper, you're not only increasing the fluence, the energy, but also increasing the spot size. So you have few variables that you can play with, but this is for when you finish the 100th session, due to the guidelines from the machine, then you can start to play with. Or you are expertise like our colleagues. Okay, so I think we could find telangiectasia on 90% of the faces sitting here. So potentially, we all are the patients for the machine, because everyone has some of the telangiectasia. So the number of potential patients is very, very high, and it's very effective. Look at that woman. She is one of the first our patients for telangiectasia. This is the picture afterwards. She came 2 weeks after treatment with a complaint, and I said, What's wrong with the treatment? It's very effective. And she said, yes, but I have some lines, which I didn't have before the treatment. And I just saw at her that it was so effective that it made spots without any vessels. And the spot is round. So my colleague was irradiating spot after spot in the lines, and those are undone areas between the lines. So the patient was pissed off, and we were very happy because we actually had very, very effective system in our hands. So you have to remember about overlapping, especially on the décolletage, on the neck, not to leave those little lines. Of course, you can redo it within a few weeks and finish the treatment. Okay, that's another example of the port wine stain. Done many sessions with IPS and pulse dye lasers with no effect, and you can see one session with the CUTERA and those white spots, meaning that it is really, really effective. 3 sessions with 532 for the port wine stains, very good results. 3 sessions is very few. Normally we have to take between 8 to 20 to get rid of the port wine stains. Capillary malformation, which is very simple to treat because the capillaries are quite superficially located, so it is a tremendous effect after just 1 session. And sometimes we have difficult indications, difficult patients. That lady is still our patient. It's been 2 years when she came to us, and she's still having the port wine stains because the vascular problem is very deeply located, and she has the hypertrophic lesions here, which limit our efficacy. But she's happy with the result. Yeah, it's been 2 years, but she's still motivated because she sees improvement every time she comes. And I'm glad that we have a representative of the patient. I don't know how to say it. Patient organization with us, yeah. Because patients with port wine stains, they were told for the whole life that it is untreatable. So they had social problems, problems with getting married, social problem with getting friends, problem with going out, that they didn't want to be pointed out by any other people. And we emitted the television program with people with port wine stains, showing that we can treat the problem. So after that, we have one new patient a day, because they saw that it can be treated. Sometimes it is still visible, but in most cases it can be treated. Of course, it takes money, it takes time, it takes at least 1 year, but you can see it can be treated. It's very important. Yeah, she's wearing some makeup, of course, but nevertheless, the comfort of life increases dramatically for those patients. Okay. Sometimes we have a vascular problem on different levels. So you can see one session, everything what was superficial is gone, and some purple, deeper lesions were left and waiting for 1064 treatment. The nose may be difficult for the removing of the vascular lesions, because we are told to keep the pressure on the skin, yeah, not to have any air bubbles between the glass and the skin, not to burn the skin. But here on the nose, the vascular network is so superficial that when you press, you get rid of the chromophore, meaning blood from the vessels. So we have a little of improvement every time. But we trying to use the imaging device. This is Canfield Vectra system. It takes the 3 pictures at one time to see the 3-dimensional picture of the patient, and it has some filters to reveal, to show the vascular lesions, and you can definitely see the results. It is very important to motivate the patients for the further treatments. The same with this patient. She was complaining that it's been 3 times that she came to us and she sees no difference. So we have a difference, and we have to show it to patient to motivate, because the way to get rid of the port wine stain is very long. The other thing to anticipate the efficacy is what every dermatologist have, which is dermatoscope, and it's enough to just look under the dermatoscope on the type of the veins, and you can see whether they are superficial and easy to treat, or there is a mist, a purple mist, which means that the vessels are deeper, and we will have some problems with treating them. You can see after one session, white spot with no vessels, and undone area between them. If you see in dermatoscope such red lines, superficial, you know that it will be quite easy to treat. The worst ever is the reticular pattern of the vessels, meaning that it will be at least 10 sessions or maybe more. And we have some differences between the areas. The neck is responding very well in most of cases, comparing to the nose, which is responding quite poorly. And you can see the same patient in the Vectra's imaging system. You can see the efficacy here and almost no efficacy around the nose. That's the optical coherence tomography, which we are trying to engage in our work. It's like a real-time looking deeply into the skin. It's like the ultrasound, but the resolution is very, very high, and up to the 2 millimeters depth you can see everything in the skin. And this is the port wine stain before irradiation. You can see the vessels here, and after irradiation, closed vessel. This one is unclosed, so you can use it to control the efficacy of your treatment, and you would have to do again this vessel here. This is just first steps. It is not officially said, so I'm giving you some kitchen tips from our side. There is a definite difference in response to lasers between the areas. When it is distal, then you have a little problem with the efficacy and more sessions needed to achieve the clearance of the face. The other one is the nose. So coming back to our discussion, 1064 or 532. This one is purple, seems to be quite hypertrophic, so deep. So we thought it should be 1064. But look at, we chosen to use 532, more superficial, 4 sessions with a very nice improvement. There are, of course, some residues left here to be done by 1064. So I must tell you, comparing 532 to 1064, we're using 10 times more 532 than 1064. Treating children is a little bit differences we have here, because children react very good for the irradiations. That's only 1 session, and you can see already a nice improvement. Unfortunately, most of our children need to be anesthetized generally, because they don't. They have a fear of pain more than pain itself. I think we have some difficult indication. This port wine stains is located very deeply into the skin. It's been more than 10 sessions with a noise effect, but it's still there. Of course, if you look at it from the psychological point of view, spoiled life, normal life with makeup. So the quality of life is uncomparable. We have also some real youngsters with vascular malformations, always treated with the anesthesiologist. You see the effect after 2 sessions, or venous malformations, just 1 session, 1064, almost done. Veins. We have, I must admit that we have vein surgeons in our clinic, and they are not very keen on using lasers. They still want to do the sclerotherapy and other tools they are using. But it's very comparable to sclerotherapy, I must say. You can see the this is the 4 weeks interval, how it heals before, edema right after the irradiation of the vein on the leg. Then we have a little bit of the hyperpigmentation, and then the clearance of the veins. Comparing to sclerotherapy, the efficacy is, I think, is just the same. But we don't need any special dressings, any special pressure stockings afterwards. We have no new telangiectasia, which happens to sclerotherapy quite often. And it works with big and small caliber vessels. Sometimes we continue sclerotherapy with the laser because some very small, thin, red vessels are left after sclerotherapy. So it may be a nice continuation, or you may try to use it instead of sclerotherapy. And additional advantage is that the patients want to have new technologies. Sclerotherapy it can be done in every clinic in Warsaw, but some of them only have some very effective lasers. So patient says, I want a laser, not an injection. That's another point. Okay, for the veins, it's very important to have a cooling device at the tip of the end of the handpiece, and the visibility through the sapphire glass, which you in real time can see how it reacts with the vein. And especially in leg veins, you have to keep to the settings that are guided by the machine, because it's very, very easy to burn with a very potent, very strong machine that we have here. Some examples of the venous malformations, which are quite more difficult than the normal veins on the legs. And the last thing that I've chosen the XLV is ease of use. You can see the old KTP. That's my colleague wearing the magnifying lens with a special polarized lamp, and he was doing the whole face. It was impossible to do the whole face. We were cutting it into the few steps, like one cheek one time, because it took about an hour. And always a nurse blowing the cold air because it was the device was without any cooling. Right now, he's standing, he's in a comfortable position, the cooling is in the tip, the guidelines is very helpful, and the whole face takes 10 minutes. Safety, safety. Again, the right parameters. If you are a beginner, always keep to the settings that are provided by the machine. Pressure tip, always have to keep the contact between the sapphire glass and gel and the skin. We sometimes learn how it should sound. If you hear no sound, you're probably less effective. If you see ticking, it means we have some reaction from the vessels. If you hear like a popcorn pop pop, it means that you probably already burnt the vessel. So the same with the change of the color. If it disappears, it's good. When you see it is getting bluish, especially the port wine stains, it's okay. But if you see sudden whitening, especially when you use 1064, it means it's a little bit too late, and you already burnt the skin, and it is usually a very severe burning, and you have to immediately cool the skin for at least an hour. We inject, if you have this whitening, we inject immediately any kind of solution like saline ether to cool the area, to give the overheat to the solution that you are injected into the place. Sometimes it happens, especially when you already think you are an expert and you don't obey those stupid settings on the machine. Cooling afterwards is mandatory because the edema is less, the possibility of side effects is less. And in our clinic, we use LED treatment afterwards. It's red LED, which helps to heal the skin. Because if you irradiate the vessel, always there is an overheat, and this heat goes through the vessel to the skin, and skin gets harmed somehow. Normally, it's only edema. But I think when you use LED light, then it's 30% less shorter time of the healing. For the cooling, we use all cold packs or Zimmer with the blowing air or contact cooling. You can see we are in side effects, and I must admit we forgot about the patient. So our friend do the treatment. You can see that was a port wine stains on the forearm. This is typical bruises afterwards. And he left the patient with a cold pack, and he forgot about him. So it's a freezing blisters from the cold packs, but fortunately gives no scarring. So remember to let your patients go home. Pain management. Normally we have a little bit problem with the painkillers for those patients because you cannot apply any anesthetic cream because it contracts the vessels. So we do it without any anesthetic. Sometimes we use the blockades on the nerves if it's suitable. Sometimes for youngsters we use general anesthesia. Sometimes we use a laughing gas, which is very useful in many indications in our clinic. It doesn't lower the pain, but patients don't care, because they get high a bit. It's very nice. Have you tried that? No, it's legal. Okay, side effects: edema, superficial crust, bruises, and this is the line that it is normal. Yeah, here it starts something worse. Blisters means that you burn the patient. Hyperpigmentation, mostly the post-inflammatory hyperpigmentation, lasting for a couple of months at least. Hypopigmentation means that we produced a scar. It is not atrophic yet, but hypopigmentation means that there are some process of scarring, and the regular hypertrophic scars, atrophic scars, bruises and crusts, normal. I can't remember that I have ever produced with the CUTERA post-inflammatory hyperpigmentation, so it is from internet. It usually stays for a couple of months and needs to be Q-switched for several times to get rid of those. Superficial burn, no longer blister here, but we have a little scar, a little crusts here. And this is MMS from my patient next day. You can see little blisters, meaning that was too much, and a very severe edema. If you're using a large spot and you're in a hurry, I was in a hurry, that was my fault, you will have edema like this. She looks like an Eskimo, she is a slim patient. Yeah, that's all of those are edemas. I remember one patient. She was living in Australia. She came from the for the XLV, and next day she came back asking for the statement that she was under the treatment because she was afraid that the guards will not let her through the passport control, because she was not resembling the lady on the passport picture. Okay, and this is the worst ever side effects, which is atrophic scar. That's also an MMS from Oslo, I think, from my patient. And I knew, already I've done it, I knew it was bad because I've heard poop and the whitening of the tip of the nose. Of course, we cooled the patient for at least 1 hour. We irradiated him with a LED light. I injected him with a solution. Nevertheless, he was the atrophic scar, which was quite successfully afterwards treated with the fractionated CO2 laser and the injection of hyaluronic acid, which not only fill up the scar, but also stimulate the collagen production. So he's still my patient and he still likes me. Maybe that was because he was Norwegian, I don't know. There are some difficult areas on the face, which is the periorbicular area and around the nose, which you have to be extremely careful, especially when you're using 1064. 1064 here is used for the very blue veins on the nose, like in this Norwegian guy. Or we have sometimes patients with no fatty tissue within the lower lids. And there are some visible veins on the lower lids, and because of the cosmetic point of view, they want to get rid of those. So you have to, because then we use in 1064, you have to be extremely careful. That's another patient with atrophic scar here. You have to remember about the pressure. You have to keep the pressure on the skin, and the gel which takes the overheat from the vessel. So, in my opinion, the system is efficient, safe, if used wisely, versatile, no doubt, and absolutely easy to use. That's why we have very satisfied patients. You can see this nice little girl, and you can see the doctor's satisfaction. This is our scheduled program from one of the Saturdays. The violet are the CUTERAs. So you can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 procedures a day, one day. So we have 2 lasers so used in our clinic. One is the hair removal and the other one is this one. Though we have at least 20 systems, we're trying to have every toy from the market which is worth. But CUTERA, it's even, I asked doctors working for me that when you finish your treatment, you have to move the system out from your room because another person is already waiting for it. So I wish you the same success with the XLV, and thank you for the attention.
Adjustments also on the handpiece to change the spot size, but with every touch it changes by 0.1. So if you want to change it by millimeters, do it on the screen. If a little bit on a spot size. Okay. Only the lateral part. This is what patient wants. It'll be easier for you to stand here. I'll give you the paddle. Sorry. Yes, I'll hold it. And just fire one shot, and we'll see how skin looks after that. Oh, let's start. Yeah.
Can I make it flaking?
What do you mean?
Not permanent. Okay.
Pressure. Let's see. Let's see. Let's see. Not in one place. You see the grayish thing here? It became gray, so it's good here. So now, can I hold it for a second? The spot is 7 millimeter, so you do like this. You just change. Not to shoot in one place more than once, right?
Can I have a look?
Yes, sure. He will have a bruise here. It is not whitening, it is graying of the skin. Yeah, please. Sometimes when we are careful and we don't want to make burning, then you may skip one area. Shoot, skip, shoot, skip. So it'll be like poikiloderma then. Yeah? Yeah, right. Is it painful? Boli это?
No.
Absolutely nothing. The patient says it's not painful at all. Well, it's good. And we have some undone stripe here. Yeah? You can see undone, undone. We can do it now. I'll give him, okay, I'll not. You just look at the change of the color. Here to the sound, unless it gives you a pop. And you definitely need to have a better light than we have now. So you could see everything that you are doing. Okay. Okay. We will not do the whole port wine stain because the patient don't want to. Yeah.
Gray spots.
Yes.
It means
It's good?
it was enough.
Yes. He should have the whole thing done, but tomorrow he will be swollen and in whole in bruises, so we will not do it today. I brought with me special metal covers for the eye bulb to apply into the eye to do the lids too. But you know, first things first. Okay. You should cool your skin now. Okay. Please take the coat pack and cool your skin for at least 10 minutes. Okay. I think we're done. Do you have any questions? If not, thank you very much. Thank you, my fellow doctor. Все в порядке?